Time now for News Extra, brought to you by Gehring Civic Center. Here's Kevin Mooney.
Thank you, Dennis. Good morning, everyone. Our guest today is Jennifer Schwab. She's the CAPWN Navigator Program Specialist, and she is here with that title. You're going, well, what does she do? Well, she helps out with health insurance and the federal marketplace open enrollment period coming up again here for about 3 months. It starts November 15th, so just a couple of days from right now on Saturday, runs for 3 months through February 15th. So she's here to tell us about how this works again. And, of course, we went through, Jennifer, first of all, welcome to the show. We went through this 6-month program last time. This time it's a 3-month period, so it's not quite as large, right?
Right. There's half the time to enroll for this next open enrollment period. So starting November 15th, you can start applying to get coverage for January 1st of 2015.
All right. So, and last year, you had well over 1,000 people enroll. So you guys did pretty well.
We did, and that's just at our agency. That doesn't include, people who decided to enroll on their own without our assistance. That's just the number that we helped alone at CAPWN.
That's pretty good. Okay, so appointments begin again next week. If people are interested in enrolling and say they don't have an appointment, what do they do?
Without an appointment, we will take walk-ins if we can. So if you're out and about and you just want to stop in and talk with one of us, you're more than welcome to do that. An appointment is going to guarantee you that someone is available to help you, though. So you can give us a call, and we will set that up for you.
All right. And the number, there's an 800 number for you to call?
Right. It's 1-877-977-3906.
Okay, we'll repeat that before we're done here this morning. 877-977-3906. And when people come in for an appointment, do they need to bring anything? What happens?
Yes. As many of you know, there are subsidies available through the marketplace, so you can get some financial assistance to help pay for your health insurance. So if you're interested in seeing if you're eligible for that, we will need income information. And it is a little tricky. You have to project your income for 2015. So income information is important, as well as birth dates, social security numbers, or document numbers for anyone legally residing in the U.S.
All right. How do you project your income? I mean, especially if you're like a farmer or somebody that's self-employed like that?
That is really difficult for self-employed people. And so what we encourage them to do is, estimate on an average year what your income looks like, for farmers, self-employed people, and you can always make changes throughout the year. So if you estimate that your income is going to be X and you realize 3 months throughout the year it's going to be less or it's going to be more, we can always make those changes throughout the year so that things can be reconciled.
Okay. What's been the response from the people that did enroll last year?
They are very pleased. A lot of people that came in were skeptical, of course, but when we made it through the process and they saw what they were eligible for and they saw the quality of the insurance that they were able to get, they were very pleased.
Okay. All right, we'll talk a little bit about the process and some other stuff here right after this break.
For your next special event, how about a beautiful venue with 21 years experience? How about pulled pork, garlic sausage, ribeye steak sandwiches, or strawberry spinach salad being cooked by the meat shop for 31 years? The large flowing chocolate fountain could top off your perfect evening. Call West Nebraska's premier multifunction facility, the Gehring Civic Center, at 436-6888 or GehringCivicCenter.com. And like us on Facebook.
All right, we're back on News Extra. Jennifer Schwab is here. She's from CAPWN, the Navigator Program Specialist. We're talking about the health insurance marketplace open enrollment period, and that begins starting Saturday once again from November 15th through February 15th. For those of you who don't have health insurance, somehow didn't get involved with it last year, maybe the situation has changed in your life and now you don't have health insurance. You did last year. You need to get it. There's a lot of different situations, right? But the process, I know last year there was a lot of bugaboos at the start. What's it like now?
They have made a lot of improvements to healthcare.gov, so the system is working much more smoothly. But as with any website, the popularity of it and the mass number of people that are coming to it, things could be slow starting off. But the system is working much better than it was last year, much fewer errors and that type of thing when you're actually trying to get through the application.
All right. And even if you enrolled last year, it might be good to kind of check things out on the website or give you guys a call about how whether or not your premium is going to increase or maybe it's going to decrease or whatever, right?
Right. If you were in the marketplace for 2014, in most cases, if you choose to do nothing, you will just roll over into that same plan with the same amount of financial assistance you were getting in 2014. But I would encourage everyone to go back to the marketplace, make any updates, and resubmit their application, because the Affordable Care Act keeps insurance within a certain percentage of your income. So if premiums go up, then your subsidy should go up as well. But you won't get that increase in subsidy unless you resubmit your application.
Okay. So that's a big thing. If you probably should check it out. You might get more help than you're getting now because your premium went up. It's hard to say, right?
Right. And then the opposite of that too. Maybe you've had an increase in income. Maybe your household size has changed. So you would want to make those updates as well, because if you don't want to be receiving more of a subsidy than you should be either.
Okay.
So.
Anything else we need to say other than give us a call, right?
Yeah, if we can help in any way. I know a lot of people want to try and do this process on their own, which is great. But if you have questions along the way, even if you're doing it on your own, you can give us a call and we can ask questions or kind of walk you through it even over the phone.
All right. The number again is 877-977-3906, 877-977-3906. These folks helped 1,131 people last year get health insurance. Their goal was 1,000, so they did a pretty good job. You guys did well, didn't you?
I think so.
Yeah. You have 4 people available to help out.
Right.
So it's not just 1 or 2.
Right.
So get in and get an appointment. If you don't have insurance, there's really no reason not to have health insurance.
I would agree. I would encourage anyone just to take a look and see what your options are. If you don't like what your options are, there's no obligation. You can just fill out the application and see what your eligibility results say. And if you don't like it, that's okay. There's no obligation to enroll when you come see us.
All right. Okay, Jennifer, thank you very much. Appreciate it.
Yep, thank you.